adduction. But then I always get this wrong. So we're going to do that's internal rotation and external rotation. Got it right, lovely. So put that back down. So now we're going to do, so that was active movements, now we're going to do passive movements. So flexion, extension, all the way down, noting the degrees he can do in each stage. I'm going to gently abduct the hip and adduct. And now, again, so that's internal and external rotation, oddly. That's fine. So, active, lift this up for me, push up against me, push down. So that's resisted movement for flexion, extension hip, push out against me, push in, push out, push in. Good. Okay, so they're the resisted movements of the hip, which are absolutely fine. So next thing comes special tests. So the first test I like to do is the Faber test. So we do, that stands for flexion, abduction, external rotation. So it's a figure of 4, like this, across the knee, and this is a test for sacroiliac joint tenderness. So support the hip, the contralateral hip with your right hand, and gently just push the knee back posteriorly, looking for the patient to see if this reproduces the pain. If this reproduces the pain, it may well be indicative of sacroiliac pain, but I don't find the test very specific or sensitive, and it's often due, patients can have pain if it's in the hip as well. The next test is TOTS test. So what you do is grab your knee for me, please, Jay, as tight as you can in flexion. And what I'm looking for is any lift off the bed of this leg here, and there isn't any. If there is any lift, so it might go sort of like this, that indicates iliac psoas weakness on this side. That's fine, and obviously you test both sides with each other. You can stand up for me. I then like to normally finish with Trendelenburgs, so just press gently on me, that's fine, lift up your right leg, and you should, that's fine. And if that was positive, you'd have a weakness, so this leg would go up to compensate for any weakness in the hip there. And again, you can do this on the other side as well. And that is a hip exam.